Hi, I'm Dr. Robin Trotman, an infectious disease specialist at CoxHealth, and I'm going to talk to you a little bit about the current status of our coronavirus. And so this is a big project. This has a lot of moving pieces. I want people to be aware that this is likely to happen. You're likely to be in contact with people with the coronavirus. The disease is called COVID. So if you do think that you have symptoms, which might be, as people know by now, a cough, shortness of breath, and a fever, and you've been exposed to somebody known to have this, or maybe that's traveled, or you yourself have traveled to one of these areas, what we're asking right now is that people don't show up unannounced to the healthcare system. That's one thing. We definitely want you to stay out of crowded areas. We want you to cover your cough, and we want you to call your doctor. If you call your doctor, if you have the ability to do a virtual visit, so if you have internet access, that's the way we'd like people to be managed initially, assuming you're not seriously ill. Now, if you have serious comorbidities, and people ask me a lot, what are these comorbidities? Well, these are lung diseases, heart diseases, or immunocompromised state. That doesn't necessarily mean you have simple hypertension and you take a pill. That's not the kind of comorbidities that we're seeing in the people who do poorly with this disease. It's more like you have serious heart failure, or you have serious coronary artery disease, or maybe you have bad emphysema, or you're on immunosuppressive drugs. Those are the conditions that would probably warrant a phone call to your doctor. What our goal is through that process is to keep you out of the clinic and commingling with patients that haven't been exposed. So hopefully you'll find somebody on the other end of the phone. That's the plan. You'll have appropriate triage through the system, and if you need to be tested, that's what we'll do. The next thing I want to talk about are some of the misconceptions. So we laugh about the toilet paper crisis, right? This is, I don't know. I get this question a lot, and people want to know, why is there no toilet paper on the shelf? And from a medical reason, I think that we should focus our efforts not on toilet paper consumption or toilet paper manifestos or stashing toilet paper. Focus on the things we know work. So those things that we know work are keeping yourself healthy. So that's a good diet. That's avoiding sick people. So if somebody in the home is sick, if you're out in public and you see somebody sick, keep your distance. We think about 6 feet. You want to take good care of yourself, and you want to be aware of your surroundings. So taking care of yourself would be plenty of rest, eating a good diet. If you smoke, now's the time to stop smoking. We know that people with smoking-related lung disease may not do as well with the coronavirus. So this may be an opportunity to think about some of those things. Those are the rumors that are going around now. I want people to know that our healthcare system at Cox is prepared. We have all hands on deck. We have just about every aspect of our healthcare system has a task assigned to dealing with this, because we want to keep people safe. We want to keep the people not acutely ill out of the healthcare system. So I want you to stay tuned and know that there will be more messaging from myself and from others that are involved in these preparations. So thanks for watching. There will be more of these messages to come, and stay tuned to coxhealth.com.